Hi, my name is Sandra Barrington, Executive Director of Sierra Nevada Memorial Hospital Foundation, and welcome to Doc Talks. This is a series where we bring local physicians to you to learn more about their education, their background, what brought them into their specialty of medicine, and a little bit about what they might think the future of healthcare looks like in our community. And today we have one of our top doctors in the community, an orthopedic surgeon, Dr. Micah Berry. Welcome in.
Thanks for having me. Glad to be here.
Thanks for taking the time out of clinic today and wearing your whites. And we appreciate that. You look very official.
Okay, good.
Well, tell us a little bit about what it takes to become an orthopedic surgeon, your educational background, and how you got to be to this point in your career.
Sure. Well, I'm born and raised in Los Angeles. I originally come from the San Fernando Valley. So I went to UCLA for undergrad, and I got a degree in molecular biology. Okay. And then from there, I went to Harvard for medical school.
Harvard, okay.
Yeah, so big jump from the West Coast to the East Coast. So went there for 4 years. I was at Harvard, and then I chose my subspecialty of orthopedic surgery. And then from there, I went back to Los Angeles and I went to USC. And I spent 5 years at USC studying orthopedic surgery in general. And then after that, I jumped up north and went to Stanford. And I was at Stanford for a year where I did 2 fellowships, one in anterior hip reconstruction and one in orthopedic trauma.
Okay, so Harvard, UCLA, USC, Stanford.
You got it.
I'm seeing a pattern of excellence here.
Well, thank you.
Very impressive.
It's a lot of hard work.
And what was it about orthopedic surgery that made you want to go in that specialty? Because there's a lot of choices in medicine.
Yeah, there is, absolutely. In sort of your 4th year of medical school, you're making your decision of the specialty you want to go into. I knew I wanted to do surgery. I knew I wanted to do surgery of some sort, and I wasn't quite certain. When I was young, I thought I wanted to be a brain surgeon, so I thought about neurosurgery. I thought about it really seriously. And then when I started rotating through the subspecialty of neurosurgery, it actually wasn't that exciting to me. The anatomy wasn't as fun. The neuroanatomy was relatively simple compared to orthopedic surgery anatomy, where it's all of the bones, all of the muscles, all of the nerves, where they attach, how they work, how they function. And it just interested me more. And so you kind of get in where you fit in. You kind of have to really self-evaluate and say, hey, where do I fit in a surgical field or a non-surgical field? Those are the 2 biggest distinctions that we make at first when we're a medical student. Am I going to go into a surgical subspecialty or a non-surgical subspecialty? It was clear for me I was going to go into a surgical subspecialty. And then I just needed to get in where I fit in, which ultimately was orthopedic surgery.
So I'm getting some Grey's Anatomy vibes from your fellowships and residency. Is it like that? Is it like Grey's Anatomy at all?
It's like that, except for all of the drama. Yeah, you don't get the fun of the drama. You know, there's not the hypersexualized region of Grey's Anatomy. That does not happen in real residency. But you do spend a ton of hours. I mean, I was probably averaging 100 hours a week in the hospital, which is why they call it residency, because you literally used to live at the hospital. You had residents at the hospital.
And we just started a residency program here in the community for family practice medicine. So doctors who are specializing in primary care physicians, and that just started this month.
So I'm super excited about that too. I'm going to be a small part of that.
Great.
Orthopedic surgery is going to be one of the elective rotations for the residents coming through, and hopefully I'll get the opportunity to work with them directly and kind of teach them about basic fracture management, because even as a primary care physician, you need to know a little bit about a lot of things. And so one of those things is orthopedic surgery, and I don't expect them to make surgical decision, but understanding basic fracture management, how to cast, how to splint, how to care for things non-operatively is going to be important for their future careers. So I'm excited about them participating.
Well, thank you for being a part of that program. It's taken a lot of years to get it up and running, and having them actually in-house, and eventually we'll have 6 residents training, so hopefully you'll be busy teaching them all those things.
Absolutely, looking forward to it.
Yeah. So what would you say is one of the most common surgeries that you do, and what services do you offer?
So I do a pretty wide range of things. Up here in a small rural community, you sort of have to, as opposed to just specializing in, say, for instance, hand surgery. I don't do just hand. Again, my subspecialties are orthopedic trauma, so I do a lot of fracture care management. So complex fracture care, necessitating surgical intervention, I do a lot of that. And then the other stuff I do is arthroplasty, which is essentially joint replacement. So I do a lot of hip, knee, and shoulder replacement. As far as elective cases go, I would say it is knee, hip, shoulder replacements in that order.
Okay.
Yeah.
Okay. And what would you say is your usual volume on a given month? How many surgeries
Of those do I do? I probably do about 40 surgeries per month. That's not all hip, knee, and shoulder replacements. Some of that's orthopedic trauma, and then some of that is other sports medicine related stuff like knee and shoulder arthroscopy, which is where we go in through real small incisions with a camera and we do sort of microsurgery that way.
Okay, and at the Hospital Foundation, we run a falls prevention program. So we're trying to teach people and educate them on how to not fall. But I could imagine that falls in our community, especially with our senior population, is probably one of the biggest reasons people end up in your office.
Yeah, unfortunately it is, and oftentimes it's preventable. But yeah, especially with our elderly population in the community, falls is a big cause to see an orthopedic surgeon when you fall and get injured, or you fall as a result of an injury or a pre-existing arthritic condition where your knees or hips bother you, and so you feel a little bit unstable and sometimes you have a fall.
So it's a pretty rural community, as we all know, and recruiting physicians up here can be really challenging. Was there something specific that made you choose this area, and what do you like about living here?
Yeah, there was something specific, and I love living here. I think that for me, as I was sort of starting to branch out and look for jobs after my training, that Grass Valley specifically always held a little special place in my heart. And even though I'm born and raised in Los Angeles, I used to spend my summers up here with my grandmother. Yeah, she lived up here. She's since passed, but she lived up here for many, many years. And when I would come up here and spend my summers, I used to go houseboating with her on Lake Inglebright.
Oh, wow.
Yeah, and it just always was someplace special. It was sort of a little bit of an oasis for me coming from a big city. And so when an opportunity presented itself up here after my training, I thought, what a great place to start my career. And I've been here since.
Oh, that's really sweet. Well, we're glad that you're here.
Oh, well,
thank you so much. And, if we had a crystal ball and we were looking into the future of orthopedic surgery in our community, what would you see as like the future of healthcare and your specialty?
Sure. I mean, gosh, I wish I did have that crystal ball, right? But I think, with the aging population, particularly of the baby boomer generation now, I see a lot of increases in total joint arthroplasty. So a lot more hip, knee, and shoulder replacement. So that's sort of just increasing, and it's been increasing on a yearly basis. But it's continuing to explode. So I think that for specifically within orthopedic surgery is going to be the future for a long time. They're very reproducible surgeries. They have very excellent outcomes, and it provides a significant amount of pain relief for those patients who require those sort of surgical interventions. And then as far as the future goes, I think from a research perspective, I think one of the biggest things moving forward is going to be, rather than replacing the joint, the idea would be to restore the joint. So rather than put big metal parts in to replace the joint, which is what we do now, which frankly is sort of a barbaric way to save somebody's joint, I think a better approach would be, well, why don't we, instead of replace it, why don't we regrow it and salvage it? Cure the arthritis, regrow the cartilage that's in the joint, and regrow the meniscus that could be torn in the knee. I see that happening in the future. It may not be in our lifetime, but I think it will happen, especially with the advent of new sort of technologies with stem cells.
Oh, that's fascinating.
Yeah.
Well, if we get a chance to see that, we look forward to that future of healthcare. And thank you so much for joining us today. And you have been watching Doc Talk with Dr. Micah Berry, orthopedic surgeon here in Grass Valley. And you can find us on Nevada County Media or support SierraNevada.org and look for our Doc Talks.